Okay, now that the modules are done, let's do a little bit of a review. And so you can see the questions there on the screen, and I'm going to read the question to you, and then I will highlight the correct answer. Number one, approximately what percent of energy in the glass vacuum is converted to X-rays at the anode? The correct answer is A, 1%. So out of all of that heat that is created inside that glass vacuum, 1% is converted to X-rays or converted to photons. The other 99% trickles out through the copper stem and into the insulating oil. Number two, low frequency electromagnetic radiations have blank wavelengths and blank energy. Correct answer is D. They have long wavelengths and less energy. Remember the analogy to the hills or the mountains that I talked about. It takes you a lot longer to gather up the steam to go up that big long hill, and then more energy or less energy again to come back down the other side. And when you have longer times in between your wavelengths or longer times in between your crest with more distance to travel, you're going to have less energy. Number three, the safe light must be placed a minimum distance from the film and the working area. The minimum, so the closest it can possibly be. And that is D, 4 feet. Number four, which size film is used for bite wings on children with a primary dentition? So not a mixed dentition, only the primary dentition. The correct answer is A, size 0. Size 1 would be to examine the posterior teeth of children with mixed dentition. Size 2 is going to be adults. And then size 3 is the longer, narrower film. And it is no longer recommended. Number 5, which size film is only used for bite wings? And that is going to be D, size 3. Number 6, the lead collimator carries the Number 6, the lead collimator A, carries away the heat produced during production of X-rays. B, permits a small number of X-rays to exit from the tube head. Let me do that one over. Number 6, the lead collimator. A, carries away the heat produced during production of X-rays. B, permits a small number of X-rays to exit from the X-ray tube. C, filters the longer wavelength X-rays from the beam. Or D, restricts the size of the beam. The lead collimator. The correct answer is D, restricts the size of the beam. Number 7, the purpose of the anode is to A, produce electrons when heated, B, convert X-ray electrons to photons, C, absorb heat created by the production of the X-rays, or D, filter out non-penetrating longer wavelength X-rays. The correct answer is B, convert. And the correct answer is B, convert X-ray electrons into photons. 8. Which of the following traditional units does not have an SI equivalent? A, the Rankine, B, the rad, C, the rem, or D, none of the above. And the correct answer is A, the Rankine. Number 9. Which of the following describes the use of a filter in the dental X-ray tube head? A, reduces the size and the shape of the beam. B, removes low-energy X-rays. C, removes the dose of radiation to the thyroid gland. Or D, decreases the mean energy of the beam. The correct answer is B, removes low-energy X-rays. 10. The overall blackness or darkness of a film is termed A, contrast, B, density, C, overexposure, or D, polychromatic. And the correct answer is B, density. Number 11. What is the term that describes how dark and light areas are differentiated on a film? A, contrast, B, density, C, intensity, or D, polychromatic. Correct answer, A, contrast. The latent period in radiation biology is the period of time between A, exposure of film and development, B, subsequent doses of radiation, C, cell rest and cell mitosis, or D, exposure to radiation and clinical symptoms. Answer is D, exposure to radiation and clinical symptoms. This is asking about radiation biology. The correct answer is D, exposure to radiation and clinical symptoms. Remember, we're talking about radiation biology here, not the actual film development. Which of the following is considered radioresistant? A, immature reproductive cells, B, young bone cells, C, mature bone cells, or D, epithelial cells. The correct answer is C, mature bone cells. Number 14. The quality of the X-ray beam is controlled by A, kilovoltage, B, milliamperage, C, exposure time, or D, source to receptor distance. The correct answer is the quality of the beam, or the quality of the beam is controlled by A, kilovoltage. Number 15, an organ that if damaged, Number 15, an organ that if damaged, Number 15, an organ that if damaged diminishes the quality of an individual's life is termed A, critical, B, somatic, C, cumulative, or D, radioresistant. The correct answer is A, critical. Number 16, which statement is incorrect? A, dental images benefit the patient. B, in dental imaging, the benefit of disease detection outweighs the risk of damage from radiation. C, dental images should be prescribed only when the benefit outweighs the risk. Or D, X radiation is not harmful for living tissues. The correct answer is D, X radiation is not harmful for living tissues. It is harmful for living tissues. However, we know that in dentistry, it is such a small amount that there is little to no risk. Number 17, dental X-ray film that is placed inside the mouth and used to examine the teeth and supporting structures is termed. Number 17, dental X-ray film that is placed inside the mouth and used to examine the teeth and supporting structures is termed A, duplicating, B, intraoral, C, extraoral, or D, none of the above. Correct answer is B, intraoral. Number 18. The purpose of the lead foil sheet in the film pack is to A. Protect the film from primary radiation, B. Protect the film from saliva, C. Protect the film from backscattered radiation, or D. Distinguish between the patient's right and left side. And the correct answer, C. Protect the film from backscatter radiation. Number 19. Which film is the standard size? A. 0, B. 1, C. 2, D. 4. Correct answer, B. 2. Number 20. Which is the largest intraoral film size? A. 4, B. 3, C. 2, D. 1. Correct answer, A. 4. 21. A screen film is more sensitive to fluorescent light than to direct exposure to X-rays. Screen film, so we're talking about extraoral imaging. Screen film, more sensitive or less sensitive than direct exposure to X-rays? A screen film is more sensitive to fluorescent light than direct exposure to X-rays. That is true. 22. The device that transfers X-ray energy into visible light is termed A. Cassette, B. Non-screen film, C. Screen film, or D. Intensifying screen. The correct answer is D. Intensifying screen. 23. The device used to hold the extraoral film and the intensifying screen is termed. Number 23. The device used to hold the extraoral film and intensifying screen is termed A. Screen holder, B. Film holder, C. Cassette, or D. Any of the above. Correct answer is cassette. 24. Increasing the milliamperage, or MA, will cause A. An increase in density and the film appears darker, B. An increase in density and the film appears lighter, C. A decrease in density, the film appears darker, D. A decrease in density and the film appears lighter. The correct answer is A. An increase in density and the film appears darker. And the answer is A. An increase in density and the film appears darker. 25. A dental patient has thick, soft tissues and dense bones. To compensate for this increase in subject thickness and provide a film of diagnostic density, the dental radiographer may A. Increase exposure time, B. Increase milliamperage, C. Increase operating kilovoltage, or D. Any of the above. The correct answer is D. Any of the above. Changing any of these factors based on the subject thickness can make your film more diagnostic. You just have to remember that sometimes when you increase one, you have to decrease another. 26. The capability of an X-ray film to reproduce distinct outlines of an object is termed A. Sharpness, B. Magnification, C. Distortion, or D. Diagnostic quality. And the correct answer is A. Sharpness. 27. Any leaks of white light into the dark room will cause A. Film fogging, B. Reticulation, C. Overdeveloped films, or D. Underexposed films. And the correct answer is A. Film fogging. 28. The thyroid collar, A, is recommended for all intraoral films, B is recommended for all extraoral films, C may exist as a separate shield, or as a part of the lead apron, or D, both A and C? Correct answer, D, both A and C. 29. A film badge is A, worn at chest level, B, worn at waist level, C, also called a dosimeter badge, or D, all of the above. Correct answer is D, all of the above. You wear the film badge based on what the manufacturer says. So some will be worn at chest level, some will be worn at waist level. And number 30, blank speed film is currently the fastest available on the market, and that is C, F. Let me redo that one. I didn't read the options. Number 30, speed film is currently Number 30, blank speed film is currently the fastest available on the market. A, D, B, E, C, F, or D, G. And the correct answer is D, F. F is for fast. 31. Which type of PID would be most effective in reducing patient exposure? A, 16-inch round PID, B, 16-inch rectangular PID, C, 8-inch round PID, or D, 8-inch rectangular PID? The correct answer is B, the 16-inch rectangular PID. 32. The film emulsion is composed of a homogeneous mixture of A, calcium and lead salt crystals, B, gelatin and barium salt crystals, C, gelatin and silver halide crystals, or D, primer and silver halide crystals. Correct answer is C, gelatin and silver halide crystals. 33. Why is it important for a dental assistant to recognize normal anatomic landmarks? A, to diagnose, B, for mounting X-ray films, C, for quality control, or D, to help identify the patient? The correct answer is B, for mounting X-ray films. 34. When the bisecting technique is used, the central ray is directed at 90 degrees to the A, long axis of the tooth in the same arch, B, long axis of the tooth in the opposing arch, C, the imaginary bisector, or D, the film. Correct answer, D, the imaginary bisector. 35. For shortened images, refer to images of the teeth that appear blank. This is a result of blank vertical angulation. A, shortened and insufficient, B, shortened and excessive, C, too long and insufficient, or D, too long and excessive. The correct answer is B, shortened and excessive. The correct answer is B, shortened and excessive. So for shortened images, refer to images of the teeth that appear shortened. This is a result of excessive vertical angulation. 36. The recommended posterior periapical exposure sequence for the bisecting technique is to Number 36. The recommended posterior periapical exposure sequence for the bisecting technique is to begin with A, maxillary left quadrant, B, mandibular left quadrant, C, maxillary right quadrant, D, mandibular right quadrant. The correct answer is C, maxillary right quadrant. 37. In panoramic radiography, the blank rotates around the patient. A, the dental chair, B, the tube head and film, C, the tube head, D, the film. Correct answer is B, tube head and film. 38. Of the following options, a panoramic film is typically used to evaluate and diagnose A. Caries, B. Periodontal disease, C. Impacted teeth, D. Periapical lesions. Correct answer, C. Impacted teeth. 39. The zone in which structures are clearly demonstrated on a panoramic radiograph is termed A. The focal trough, B. The rotation center, C. The ghost image, D. The mid-sagittal plane. Correct answer is A. Focal trough. Number 40. A thyroid collar is not recommended in panoramic radiography because A. It blocks the X-ray beam and obscures information. B. There's a relatively low dose of radiation to the thyroid gland in panoramic radiography. C. It's impossible to sterilize the thyroid collar. Or D. All of the above. The correct answer is A. It blocks the X-ray beam and obscures information. Number 41. On a maxillary periapical radiograph, the floor of the nasal cavity appears as a blank band of bone, blank to the maxillary incisors. A. Radiolucent and above. B. Radiolucent below. C. Radiolucent. C. Radiopaque above. D. Radiopaque below. The correct answer is C. Radiopaque and above. On a maxillary periapical radiograph, the floor of the nasal cavity appears as a radiopaque band of bone above the maxillary incisors. The nasal cavity itself is radiolucent. We're talking about that bright white band of bone above the maxillary incisors. That is the floor of the nasal cavity. 42. What are the two types of bone found on a radiograph? A. Cortical and compact. B. Cancellous and spongy. D. Cortical and cancellous. Or D. None of the above. The correct answer is C. Cortical and cancellous. Number 43.